Eleanor Marsh arrived at the hospital every morning at 5:45, not 5:50, not 5:55, 5:45. With a thermos of black coffee she made herself because the hospital coffee tasted like something had died in the machine and nobody had checked on it since. She was 71 years old. She had been a nurse for 43 years. She had worked in this veterans hospital for the last 16 of them, and in that time, she had watched 3 different hospital directors come and go, had outlasted 2 major renovations, and had personally trained more than 60 nurses, who were now running wards of their own across the country. None of this was on a plaque anywhere. There was no plaque. She kept her gray hair pinned back the same way she had kept it for 30 years. She wore the same white shoes she had always worn, because the new ones the younger nurses preferred gave her trouble in her left knee. She moved through the oncology ward the way water moves, quietly, without making a fuss, getting everywhere it needs to go. The doctors who had been there a long time respected her, not always openly, the way men in medicine sometimes avoid saying what they know out loud, but in the ways that matter. They paused when she spoke. They read her notes carefully. They stopped when she put a hand on a chart and said quietly that something did not feel right. Dr. Marcus Vale was not one of those doctors. He had arrived at the hospital 14 months ago from a private practice in the city. He was 40 years old, vascular specialist, very good at his job, and entirely certain of it. He spoke in confident sentences that ended without question marks. He walked through rounds like a man crossing a finish line. He used the word frankly, the way other people use punctuation, constantly, and without much purpose. He was not cruel to Eleanor. It was worse than that. He was politely dismissive, which is the kind of thing that doesn't leave marks anywhere. The patient who changed everything arrived on a Tuesday in November. General Raymond Holt, retired, United States Army, 4 stars, 82 years old. Stage 3 prostate cancer, transferred from a private oncology clinic, following a complication that nobody in the paperwork wanted to name directly. He arrived the way Eleanor imagined he had arrived everywhere in his life, precisely on time, without complaint, and in complete control of his own silence. He was a tall man, even now, even thin from treatment and tired from travel, and 82 years of carrying himself straight. He sat on the edge of the hospital bed, rather than lying back on it, as if lying back were a form of surrender he had not yet agreed to. Dr. Vale greeted him with a handshake and a treatment plan already printed. Eleanor was assigned as his primary nurse. She pulled a chair close to the bed, sat down, and took his history slowly, the way she had always done, not standing over the patient with a clipboard, not rushing toward the next box on the form, but sitting, present, listening. The general noticed this. He didn't say so. His secondary medical file, the one from the private clinic, seemed a detail that should have transferred clearly in the intake process. It didn't. Somewhere between one hospital and the next, a note about a medication he had been taking for 8 years got buried under newer documentation and failed to surface where it needed to. Eleanor found it at 6 in the morning, 3 days after his arrival, reading through his full file at the nurse's station with her second cup of coffee. She read the treatment plan Vale had written. She read the buried note. She sat with both of them for a moment. Then she went to rounds. She waited until the appropriate moment, and then she raised one question. Just one. She described the medication, explained the potential interaction with one element of the proposed treatment, and recommended the secondary file be reviewed again before proceeding. Vale listened with the part of his face that he used for listening. He said that the team had already reviewed the secondary panel. He moved on. The residents followed. The chart cart wheeled away down the corridor, and that was that. Eleanor returned to the nurse's station and wrote her concern down in the patient notes. She included the date, the time, the specific medication, the specific interaction risk, and her recommendation. She wrote it calmly and completely, and signed her name. She had learned to do this, not because she expected it to change anything immediately, but because 43 years had taught her exactly what the written record is actually for. 3 days passed. On the 4th day, a lab technician flagged something small in General Holt's blood work. It was the kind of result that only looks significant if you already know what you're looking for. The technician brought it to the floor, and Eleanor looked at it and said, very quietly, Yes. She brought it to the team. The team reviewed it. There was a meeting. Vale used the words, "Let's not get ahead of ourselves," twice in 4 minutes, which is a sentence that has never once in history made anything better. The plan continued unchanged. Eleanor was called into a conversation, not quite a meeting, not quite a reprimand, with a hospital administrator, who spoke to her kindly and carefully about the structure of the care team and the importance of working within clinical hierarchies, and how nursing observations, while genuinely valued, operate within a broader decision-making framework. She was given a printed pamphlet about the hospital's new integrated team approach. The cover had a photograph of hands on a table. Nobody in the photograph had a name. She thanked the administrator. She returned to the ward. She checked on her patients. She straightened a blanket. She answered a call bell that had been ringing for longer than it should have been. General Holt watched her. He was not a talkative man, but he was a deeply observant one. 60 years of military life had made him expert in the space between what people say and what is actually happening. He watched how the younger doctors moved around Eleanor, how they reached past her, how she waited, and then, after the team had moved on, completed the actual work of the floor, the work that didn't get logged in the places people look when they are deciding who matters. One evening, after the ward had gone quiet, he asked her how long she had been doing this. She told him 43 years. He was quiet for a moment. Outside in the hallway, a cart rolled past. He said, "Do they listen to you?" She was adjusting the line of his IV when he asked. She didn't stop adjusting it. She said, "They hear me just fine, General." He was 82 years old. He knew the difference. He didn't push. He had spent a career knowing when to hold information and when to use it. The following morning, Dr. Vale arrived with the anesthesiologist to walk through the final schedule before the procedure. It was routine, a standard pre-procedure consent conversation, the kind that takes 10 minutes and ends with a signature. Vale placed the consent form on the tray table in front of General Holt. General Holt looked at the form, he looked at Vale, he looked at the anesthesiologist. He said, "I'd like Nurse Marsh present before I sign anything." Vale explained, pleasantly, that this wasn't standard protocol. Holt said, "I'm aware of that." A silence settled into the room. Not an awkward one, a deliberate one, the kind of silence a man uses when he has no intention of filling it. Vale said that the procedure was scheduled, that the team was prepared, that everything was in order. Holt said, "I won't proceed without her here." He said it the same way he had probably ordered the movement of battalions. Not loudly, not angrily. Simply, completely, as a fact about what was going to happen. Vale and the anesthesiologist exchanged a look. Vale said he would see if she was available. Eleanor was found in the break room, halfway through a cup of coffee she had been trying to finish since 7. Someone told her the general was asking for her. She picked up her coffee. She walked down the hall. She came through the door, and General Holt looked at her directly and said, "Tell him what you told me." She hadn't technically told him anything. She had answered one question about years and adjusted an IV line, and the rest had traveled in the silence between them, the way things do when two people are both paying attention. But she understood what he was doing. He was handing her the floor in the only way available to him. She reached into the pocket of her uniform and took out a folded piece of paper. It was a copy of the concern she had written in the patient notes 4 days ago. She had printed it before leaving that morning, because 43 years had also taught her the specific value of having paper in your hand when you need to be taken seriously. She unfolded it and read it aloud. Not the way someone argues, the way someone reads a fact, the medication, the interaction, the risk, the recommendation. 3 sentences, a drug name, a number, a date with her signature. The anesthesiologist asked to see it. He read it. He asked to see the secondary file. He read that too. He set both down on the tray table and looked at Vale. He said they should postpone. The procedure was delayed by 22 hours, while the medication protocol was reviewed and adjusted. A second review found that Eleanor's note had been accurate in every detail. The interaction she had identified was real, and proceeding on the original schedule would have created a significant complication during anesthesia. Vale did not speak directly to Eleanor for the rest of that day. The following week, he sent an email to the ward describing the situation as a valuable catch, and recommending a review of secondary file intake processes. The word catch, in this context, doing a great deal of work on behalf of a great number of other words he did not use. The procedure was rescheduled. It went well. General Holt recovered in the way Eleanor suspected he recovered from most things, without complaint, without drama, and slightly ahead of the timeline the doctors had given him. On his last morning, Eleanor arrived at his room at 5:45 to take his final vitals before discharge. He was already awake. He was sitting in the chair beside the bed, not on the bed itself, as if even now, at 82, even after everything, lying in a hospital bed was something he did only when strictly required. His posture was the same it had been on the first morning, straight, settled. A man completely comfortable inside his own stillness. She took his blood pressure. She checked his chart. She noted the results. She did all of this without rushing, the way she had always done everything without rushing. He said, "You wrote it down." She said, "Of course I did." He said, "And then you waited." She didn't answer immediately. The monitor beside his bed made its small sound. Somewhere down the hall, a phone rang twice and stopped. She said, 43 years of waiting makes you very precise about when." He looked at her for a moment. There was something in his expression that was not quite a smile, and not quite something else either. It was the look of a man who had spent most of his life in rooms full of people performing confidence, finally sitting across from someone who did not need to perform anything. He said, "I've worked with 3-star generals who couldn't do what you did." She gathered his discharge papers into order. She straightened the edge of the folder without looking up. She said, "You didn't have to do what you did." He said, "No, I didn't." A short silence, a comfortable one. She said, "Thank you, General." He said, "Thank you, Nurse Marsh." She left before the moment could become anything more than what it was. Not because she didn't feel it, but because some things are better kept whole, and sentiment has a way of breaking open if you handle it too much. In the months that followed, the hospital conducted a review of its patient intake process. The gap in the secondary file transfer protocol was identified and corrected. This became an internal policy update. The policy update was named, in the formal documentation, as the result of a system audit. Eleanor's name was not in it. General Holt wrote a letter to the chief of medicine before he left the state. It was 3 paragraphs. The first 2 were professional and measured. The third one was direct in the way that only a person with 60 years of earned authority can afford to be direct in a letter. The kind of directness that doesn't shout, because it doesn't need to. 3 weeks later, Eleanor was offered a seat on the hospital's new Integrated Care Standards Committee. She accepted. She attended the first meeting on a Wednesday morning. She brought her own coffee. She didn't mention the letter. She didn't mention a lot of things. She had never been in the habit of mentioning things when the work itself was available to do instead. Vail, the following spring, gave a presentation at a regional medical conference on the value of collaborative care models and multidisciplinary communication in treatment planning. He received good feedback. He was asked to submit it for publication. Eleanor was on the ward at 5:45 the morning of that conference, the same as every other morning. She straightened a blanket. She answered a call bell. She sat down in a chair beside a bed and took a patient's history slowly, not standing over him with a clipboard, but present, close, listening. The patient was a young veteran, 26 years old, recently diagnosed, frightened in the way that people are frightened when something enormous has just entered their life and they haven't yet found a way to carry it. He asked her how long she had been doing this. She told him 43 years. He looked at her the way frightened people sometimes look at someone steady, like steadiness itself is a kind of answer. She adjusted his pillow. She checked his chart. She told him what the morning would look like, and then the afternoon, and then the next few days, clearly and simply, and without rushing, until the room felt smaller and more manageable than it had when she walked in. Then she moved on to the next patient. She had 12 more before noon.